Welcome to our channel. Today, we're diving into a lesser-known yet significant medical condition called Fitz-Hugh syndrome. This syndrome is characterized by the presence of peritoneal inflammation that is associated with pelvic inflammatory disease, or PID, primarily caused by sexually transmitted infections such as chlamydia trachomatis and Neisseria gonorrhoeae. The name Fitz-Hugh syndrome comes from two physicians, Thomas Fitz-Hugh and George Curtis, who described the condition in the late 1930s. So, what exactly is happening in the body with Fitz-Hugh syndrome? It's important to understand that this syndrome is primarily a complication of PID. In PID, the infection spreads from the vagina to the uterus, fallopian tubes, and surrounding structures, leading to severe inflammation. The inflammation can result in the development of violin string adhesions on the liver capsule, giving rise to the characteristic symptoms of Fitz-Hugh syndrome. Individuals experiencing this syndrome often present with sharp or stabbing pain in the right upper quadrant of the abdomen. This pain may also radiate to the right shoulder, which can be confusing but is a classic symptom. Often, the pain can worsen during movement or deep inspiration. Furthermore, other coronavirus symptoms, such as fever, nausea, and vomiting, may accompany the abdominal pain, leading to a misdiagnosis as other abdominal conditions, such as appendicitis or gallstones. Diagnosis of Fitz-Hugh syndrome often involves a multifaceted approach. Healthcare providers typically will conduct a thorough medical history and physical examination. They may order imaging studies, such as an ultrasound or CT scan, to evaluate for any abnormalities or complications in the abdomen. However, these imaging tests may show only nonspecific findings, making direct diagnosis challenging. Instead, clinicians will often rely on laboratory tests to identify sexually transmitted infections, thus correlating PID with Fitz-Hugh syndrome. Treatment of Fitz-Hugh syndrome focuses on managing the underlying PID. Antibiotic therapy is the primary treatment method, and it's crucial to ensure the chosen antibiotics are effective against the causative organisms. The treatment plan usually includes a combination of antibiotics to comprehensively address the infection. Providing both partners with treatment is essential to prevent reinfection. Most patients respond well to treatment, with a significant reduction in symptoms and inflammation. However, if left untreated, Fitz-Hugh syndrome can lead to long-term complications such as chronic pelvic pain, infertility, or even ectopic pregnancies due to scar tissue formation. Therefore, timely recognition and intervention are essential. While Fitz-Hugh syndrome and PID are often more commonly occurring in women, it's essential to underline the importance of safe sexual practices for all genders. Regular screening for sexually transmitted infections can significantly mitigate the risks associated with PID and its complications. Open conversations with healthcare providers regarding sexually transmitted infections, their signs, and symptoms should also be encouraged. In conclusion, Fitz-Hugh syndrome may not be widely recognized, but its implications can be significant, especially in women of reproductive age. Awareness of its symptoms, understanding its connection with PID, and seeking prompt treatment are crucial steps in ensuring better health outcomes. If you or someone you know is experiencing unexplained abdominal pain, don't hesitate to reach out to a healthcare professional for a thorough evaluation. Thank you for joining us today as we explored Fitz-Hugh syndrome. If you found this information helpful, please give us a thumbs up, subscribe for more medical content, and share this video with others to raise awareness about this important health issue. Stay informed and take care of your health.